Hello, my name is Dominique Chavez. I did my microbiology report on chronic myeloid leukemia. So we first discovered leukemia in France in 1860, and back then the only thing that we knew about leukemia was that it caused elevated levels of white blood cells. So the only treatment option back then was arsenic that was known to lower white blood cell count, but it did nothing for the patient as far as helping them go into remission or helping them live longer lives. And it wasn't until 1960 when we discovered the PH chromosome or the Philadelphia chromosome. And this is found in about 90% of people living with CML. And this told us that chronic myeloid leukemia had something to do with chromosomal abnormalities. We didn't know exactly what at the time, but we knew it had something to do with chromosomes. And it wasn't until 1973 that we discovered the translocation of chromosome 22 to chromosome 9. And in 1985, we discovered the breakpoint cluster region, specifically in chromosome 22, and this told us that the breakpoint of chromosome 22 adding on to chromosome 9 created a protein called BCR-ABL, and this stimulated the production of tyrosine kinase, which blocked DNA repairment and was basically the source of malignant cells starting to form in the body. But with the discovery of the breakpoint cluster region, we were able to come up with a treatment option still used today called tyrosine kinase inhibitor. And this, like it says, it inhibits the production of tyrosine kinase. So it allows the healthy cells, white blood cells, red blood cells, and platelets to start forming in the blood again. The symptoms of CML include bone pain, fever, fatigue, loss of appetite, feeling really full after not having a lot of food, night sweats, and like with leukemia, the swelling of the spleen as well. So there's going to be 3 stages associated with CML. The first stage is the chronic stage, and in this, the symptoms are either mild or many times patients in this first stage may be asymptomatic. And in the accelerated stage, the symptoms just become more severe. And in the blast stage, we see the most severe symptoms. Typically, we see that with the bone pain, with the bleeding, and with the swelling of the spleen. It's pretty severe in this stage. So since leukemia kind of messes with the white cell blood count, we see that a lot of times patients with leukemia have lots of bacterial infections that they would usually be able to fight off on their own, but the lower production of platelets, white blood cells, and red blood cells don't really allow for that to happen. Thrombocytopenia is also a common symptom since the underproduction of platelets. So this causes irregular bruising, overactive bleeding, bleeding of the gums, and also bleeding under the skin. And the diagnosis for CML can only be done through blood tests. So in blood tests, they will see the elevated white blood cell count. They will confirm the presence of the PH chromosome, even though only 90% of people who have CML have this chromosome. It's still a huge commonality, and they will always test for it when testing for CML. And once CML is confirmed, they will take a sample of bone marrow, and this will allow physicians to see what stage of CML you're at, and this will also help them decide what treatment options will be right for you. So, for the chronic stage, TKIs are the most recommended treatment option. So, since it is still the beginning, most patients will be on the first generation of TKIs, and if for some reason they get if their bodies have get adapted to the first generation of TKIs, then they'll move on to the second generation of TKIs. And there's a third generation available, but only people with thymidine to isoleucine mutation can take the third generation for TKIs, because for some whatever reason, only people with this kind of mutation have success rates with the third generation. If you're in the accelerated stage, you will still be on TKIs, and they will most likely try and find someone for stem cell transplantation for you to replace unhealthy bone marrow with healthy bone marrow. And if you're in the final blast stage, you will be on TKIs for a while. It doesn't do anything to help, but it does slow down the production of malignant cells while either a transplant is being arranged, or maybe you'll be going on chemotherapy for a few months to destroy the malignant cells. Just like with all cancers, the faster physicians can recognize that you have CML and the faster you go on treatment, obviously the more success rates you will have with surviving. This is called a chronic disease now, because with the use of TKIs, many people who have this kind of leukemia can live with it, and they don't usually die of any complications from it. They just die of old age. But before the treatment of TKIs, this was a fatal cancer, but now that we have that treatment option, it's just thought of a chronic disease now. So, yay, go scientists. Thank you.